Hey there, and welcome. Seriously, just taking a moment to even learn about this stuff is a huge step, so I'm really glad you're here. Today, we're going to pull back the curtain on what a professional assessment for depression and anxiety is really all about. So let's just dive right in. Have you ever had that feeling where you're just off? Maybe you feel overwhelmed, but you can't quite put your finger on why. If you've ever wondered what it's actually like to get some real professional clarity on those feelings, trust me, you are not alone. It's a question a lot of us have. So, what even is a professional evaluation? Well, it's so much more than just a simple chat. Think of it more like a skilled detective using very specific, well-tested tools to gather clues about your emotional well-being. The whole point is to get a clear, objective picture that helps map out the best path forward, just for you. This first part of the journey, it's really all about one thing, that search for clarity. It's about moving from that feeling of uncertainty to a place of understanding. And honestly, that's an incredibly powerful move to make for your own health. And listen, let me be super clear about something important here. You don't need to have it all figured out before you ask for help. You don't have to show up with some perfect self-diagnosis you found online. Just feeling that something's off or feeling totally overwhelmed, that is more than enough of a reason to talk to somebody.
All right, so let's actually go inside the assessment room. Let's imagine you're there. What really happens? We're about to break down exactly what that appointment looks and feels like. No surprises.
Generally, it all boils down to three core parts. First, there's going to be a clinical interview, which is basically a guided conversation about what you've been experiencing. Second, you'll probably fill out some questionnaires. And third, they'll do a pretty detailed review of your personal and even family history. You might be wondering, why all the detail? Well, it's all about getting that full 360-degree view of you. A clinician is trained to see how the dots connect, between your emotional state and even physical things like changes in your sleep or appetite, and of course, your personal history. All those pieces of the puzzle are vital for creating a plan that's actually accurate and effective. And yeah, getting that level of depth takes time. A proper comprehensive assessment isn't some rushed 15-minute thing. You can expect it to last anywhere from 45 to 90 minutes. And that's a good thing. It means the provider has enough time to really listen and gather all the info needed to help you out. Now, I know what you might be thinking, but I've seen like 100 quizzes for this stuff online. So why bother with a formal 90-minute process? Okay, let's break down the real difference between one of those quick online screenings and a professional assessment. Here's a pretty good way to think about it. An online screening is kind of like taking your temperature. Sure, it can tell you if you have a fever, but it has no idea why. A full clinical assessment, though, that's the complete diagnostic workup to understand the root cause. It's longer, it uses multiple validated tools, and it includes that deep dive, that biopsychosocial review, which is just a fancy way of saying they look at your biology, your psychology, and your social world to get the whole story. And here's something an algorithm or a quiz just can't do. A trained professional can actually observe really subtle cues while you're talking, things like your level of vigilance. For instance, they might notice if you're constantly scanning the room, which is something they call hypervigilance. That alone can point to anxiety in a way a checklist never ever could. These little nuances are often the key to getting it right. Okay, so let's say you've done it. You've booked that appointment. How can you make sure you get the most out of it? Now, this isn't about studying for a test or anything like that. It's just about being a little prepared so you can help your provider help you. Here's a super simple checklist. Just jotting down a few notes on these points before you go can make a world of difference. It just helps you organize your thoughts so you can explain your experience clearly, and it makes sure you don't forget to ask those important questions that are on your mind. Now, this is so important to remember. The assessment itself isn't the finish line. It's the starting line. So what comes next? Well, this is where your journey toward actively managing your well-being really kicks off. Honestly, if there's one single thing you take away from all of this, let it be this. A mental health evaluation is not a permanent label. It is not a life sentence. It is simply a snapshot, a picture of where you are right now. And it's that snapshot that gives you the clarity and the info you need to start making positive changes. Your care plan isn't set in stone. Think of it like a living document. It all starts with that initial assessment to get a baseline, but from there, it involves regular check-ins to see what's working and maybe what isn't. After a few months, you'll review your progress together, and later on, the whole plan can be updated. As you grow and change, your needs will too, and your plan should evolve right along with you. Ultimately, this whole thing is a partnership between you and your provider.
Your active participation is absolutely essential. You can think of it like there are 3 pillars supporting your progress: being open and honest, being consistent in talking about what you're experiencing, and then following through with the plan you both agreed on. That's really the foundation for lasting change.
So we'll end with this thought. Taking that first step can be as simple as just thinking of a single question, a question for yourself or maybe for a potential provider. So what's that one question that could open the door to clarity for you? Thanks so much for joining me today.